very comparable. It's like a gym membership. It's probably cheaper than a cell phone subscription or cable subscription. And most of the time, if chronic disease management is done efficiently, the cost is very minimal and the outcomes are significantly better. So good care actually costs less. It's really the bad care that costs more, because you keep doing the same thing over and over again, and there's no coordination and there's no outcomes driven actions, which means we don't do it in our model. We don't do anything without a purpose. That means if we suggest something to a patient, there's a meaning to it, and then we need an end goal. So everything is goal directed activities. So when you have goal directed activities, you automatically bring together all the pieces, and eventually the outcome is good for the patient. And what it does is it shrinks the time, reduces the time required to get people into control, and then allows the patient to be smart enough and educated to manage that long term. So we not only we shrink the time to control, but we also improve the durability of that control. So you're not only saving time and money by shrinking the original time of control, but long term you're providing a lot of savings in terms of durability. So you don't have to repeat the same things over and over again. You just go back and you touch base. You do a little reminding, little minor modifications, and they're good to go for long durations. That basically saves money. It's just like going to the gym and learning the routine, right? So once you have a trainer go through the routine and say, okay, what are your objectives? You need to lose weight, you need to improve your muscle strength, you need to, whatever your targets are, and you set those targets and you do that, you got your formula. And then you just keep repeating the formula, you maintain yourself at that target. And then if you have a new problem, you pick up on that and you modify the problem, modify the solution. So it's really goal-directed activity that we follow, and we all the whole team has the same goals, because we set them up right from the beginning and say, okay, right now your 30-day goal is to just get your sugar under control. In 90 days we'll see if your A1C improves. Then we watch your blood pressure, or we watch your weight, or your cholesterol, or your triglycerides. Once all these things are taken care of, then we'll say, okay, what are the other goals? Once we got all your goals in order metabolically, and you lost weight, and then the next goal is to say, okay, how can we reduce your pill burden or your insulin doses or whatever else? Because those are the next expense items is drug. Mm-hmm. So if we can reduce drug utilization, maintain the same level of control, so you get both disease control as well as cost control in the long run. And we don't have to actually be bean counters to do that. We can just do it dramatically. Right? So that's the nice part, because everything else that's happening around is like, oh, you gotta monitor the number of minutes you spend with the patient, or you're gonna watch for whether you're prescribing brand drugs or generic drugs. These are all very superficial actions. They don't lead to good results. What really leads to good results is goal-directed activity, and you need to set those goals individually. A 28-year-old person with diabetes has a different goal than a 78-year-old person with diabetes. So you can't have the same objectives for everybody. So, and the same thing with, men may have different objectives than women. People who let's say a male carrier has a different objective than an office person. So you can't have a standard set of objectives. Everybody wants to be healthy, but in their own way, right? So depending on what their occupation is, what their level of activity is, how old they are, whether they're male or female, whether they're, because men don't get pregnant, women do, and so pregnancy is a different category, different objectives, right? So individualization is actually key to chronic disease management. Contrary to what everybody else will tell you in the media, where standardization is the name of the game, everybody wants to have standardized. In fact, there are organizations that train you how to what do they call it? Minimize variations in care. Okay, and that's like the exact opposite of what should be done. Variations are integral to managing diabetes, because everybody's diabetes is different, and so individualization leads to better outcomes than standardization. Yes, standardization will give you good graphs and good charts, because you can show that you got 90% of people on the same regimen and they're doing great, but it's not the 90% that's going to cost you money. It's the 10% that's going to cost you money, because in these standardization regimes, most people don't care about the 10%. Does that make sense?
It makes a lot of sense.
Right.
That's
and that's what we pick up on. We want to get those 10% also what the level of care, the type of care that they need. I'm not saying more care, I'm just saying more appropriate. Good.
What's the difference with your patients and their long-term care compared to standard treatment?
So our patients, we would like to think are more empowered and educated, and they understand the game plan. So it's like we are a team. So we don't act like their bosses or their parents. We work with them. So everybody has their own little fears and tribulations and questions. So we don't shy away from asking them, why are you not doing something? And most of the time it's an emotional issue or a financial issue or a family issue or just a circumstance. Somebody is doing 2.5 jobs and they don't have time to check their sugars or take their pills on time or eat on time. So we try to sit down with them and say, okay, how can we make this situation a little better? This also includes how we select drugs. So we may find that we may not be able to follow the textbook all the time. If somebody's doing, I just had a patient who works daytime in a school cafeteria, and then she has an evening job that does housekeeping in a nursing home. And so she's home between 2 and 4 p.m. And that's her main meal, because she's working from 8 o'clock to 2 o'clock in school, and then she goes 4 to 10 in the nursing home. So how do I tailor their medication? So everybody has their own little individual requirements. So by teaching them, okay, what is their goal? How do we involve their actions towards getting to a goal? And everybody's goal can be different, and goals can change for the same person over time. And so there's nothing that is a fixed entity or a fixed target. We keep moving depending on how the circumstance changes. But that's what our patients appreciate, is we allow them to tailor their goals based on what they're doing and where they are. But we also don't shy away from advising them that there are certain things they must not do, because that's harming their ability to improve. So I think that's where our patients differentiate themselves from patients elsewhere, is we allow them that flexibility, but we also give them the structure to fill in themselves. So we give them the boxes, and they can fill in the boxes themselves. So if that makes sense to most people who are observing.
So the Signature Diabetes Institute works on people in a much more individual basis.
Correct. So individualization is the key to success. And again, we have to define what success means. And success could mean different things to different people. Mm-hmm. And we sit down with them, and that's usually our first meeting, is to understand how they are, what they are doing, what their daily lives look like. And then we say, okay, look at your test results and whatever the test results show, and obviously they are here because they are not in a good shape. That's why they're here to see us. So we then say, okay, so this is where you are, and this is where we need to be in 60 days, and this is where we need to be in 100 days or a year. So how do we get from here to there, and what's the most efficient, doable thing that we can do? And so we plan out their strategy, and sometimes some people like big strategies, some people like small strategies. Most people like to take things in small bites. So we'll say, okay, we have to climb Mount Everest, but we're not going to climb 29,000 feet in one day. So we're going to say, okay, we'll climb the first 1,000 feet, and we get to the next level, and then we'll figure out how the weather looks like up there, and then we go from the next to the next to the next to the next level. Ultimately, they are on our team, and then we just do things very coordinated, and if things fall off the wagon, if people, it happens all the time. Chronic disease management is never a permanent thing. So people doing wonderfully well, all of a sudden show up and they're just doing bad. Then we sit down with them and say, what happened? And most of the time there's an event. We just had another patient today. She's a special ed teacher. Husband was diagnosed with prostate cancer. Actually, it's very sad that she lost an adult daughter 2 months ago. So all of a sudden things just fell apart, and whatever she was doing so nicely, all of a sudden she doesn't remember if she's taking her insulin dose, checking her sugars or not. So we sit down and we say, okay, look, this happens to everybody, and we just have to find a way to. So that's where we use our mental health counselors that work with us. So, and some of the mental health counselors are particularly interested and trained in diabetes management from the psychological standpoint. So we, clearly, diabetes, chronic disease management has a lot of psychological components to it. Basically they must want to know why they have to put the hard work in and the effort. Otherwise, there's no end point. So people have to buy into the process, and buying in takes a lot of psychological change. So we use our psychological counselors, our mental health counselors, to sort of give them support. Usually it's family support or other coping mechanisms, techniques to reduce the impact of life events on chronic disease management. So ultimately, what happens to you, what happens to a family member, friend, can reflect on how you manage your disease. So again, that's another unique feature that we use, and our dietitians do the same thing. They have a very personal relationship with the patients. They understand their family. They understand sometimes they will even go to their houses and deliver things if they're short on supplies for a pump, for example. They will go and drop them off. I've had a patient,
house calls.
I have had a patient who decided she wants to start on an insulin pump, and summer had just started last year, and she was in her shore home in New Jersey, and Leslie went down there and made it a vacation on a weekend, trained her on the pump, gave her all the supplies, and she was off on a Saturday. So we have done all those things, and it's not unusual for us to do that, and that's the beauty about what we do.
So you really put the patients first.
Correct. Patients are really where they're supposed to be in the whole healthcare universe, is right in the middle. I mean, they are the focus of. Obviously, there's no healthcare system if there's no patient, right? So that's the bottom line, and so we need to keep that focus back on. I mean, right now that's the whole issue: the cost, the quality, the litigation, the unhappiness, everything that's happening in the healthcare system right now is primarily because the focus is gone from the patient. Now we are focused on documentation, we are focused on avoiding litigation, we're focused on time management, we're focused on cost management, we're focused on metrics, and all these things are distractions. There is no reason for us to get involved in all these things. If we just focus on dealing with the patient as the center of the healthcare universe, and they are our partners directly, one-on-one, we will improve the quality, we'll reduce the cost, we'll make people happy. Physicians who are under tremendous stress, highest levels of physician suicides in the last 5 years, that will come down, and we will actually have more competition in the healthcare sector where other expensive items will actually reduce in cost, because now we have empowered patients who can make logical decisions with the help of their physicians.
And I'm suspecting that as a physician, when you're working with your patients and having them central to what you're doing, and you see that they're improving their health, that gives you a lot of satisfaction.
Sure. I mean, most of the physicians that I have seen and worked with, they've always wanted to get professional satisfaction. Nobody went in there and said, I'm going to make $1 million or $2 million or whatever. I've never heard a physician say that. So to me, if you can have professional satisfaction and make the extra money or whatever else you want to do, that's a double benefit. But that's not the primary objective. The other way to look at it is when patients understand that we are on the same side, we are on the same team, and we are their advocate. They will do what's necessary. Even if it's a difficult task we give them, they'll do it because they'll come and tell me, I did it for you. And I tell them, no, you did it for yourself. I'm just the messenger. And and then they'll actually tell me that, and they'll come and tell me, I'm just doing it because you've been so good to me, or I really understand that you care, and your whole team cares about us or me. Or sometimes, a lot of times, we see husband and wife, or brother and sister, or husband and wife and kids, and we see a whole bunch of people in the same family, and most of them are referred by one person who came to see us first, and then the second and third and fourth member of the family. So it brings them into the game, and because unlike something that's a one episode thing, you broke a bone and they got it fixed, or you had a gallbladder attack and took a gallbladder. Diabetes and chronic disease management is a lifelong effort. So if you don't have somebody who's motivated for their life, it's very frustrating for us too, because we don't get the outcomes, and it seems like we are playing the same message every time they come in. Oh, you didn't do this. Oh, you didn't do that. Why didn't you do this? We don't hear a lot of that from our patients, because they understand that we are playing on the same team, and it's their success that we are looking for.
And they feel accountable to you.
True.
With that relationship.
Right. And they feel actually accountable to themselves.
Mm-hmm.
And we try to sort of go out of our way to tell them that you're not doing it for us. Mm-hmm. We are only helping you to help yourself. Mm-hmm. So whatever tools or people we need to use to help us, we will use all those tools and people, but ultimately it's your health that matters in the end. And they realize that. And we don't even talk about cost savings or any of those things. We just say, if you do the right things, all those things will happen. And then in the end, we've had a lot of patients who tell me, oh, once I go on insulin, I'll never come off of it. That's, again, not true. We have had several patients who have come off of insulin. And that's purely due to their determination and their willingness to do what's necessary to say, okay, I know you put me on insulin, but I'm going to come off of it. And they haven't come off of it by being bad or being poorly managed. They actually maintain their control and come off of the insulin, which is really very remarkable. Mm-hmm. And we help them do that. And from a systemic standpoint, that's actually good, because then we can actually reduce the cost of drugs by reducing the use of insulin. And that's a wonderful thing.
Well, Dr. Cavale, thank you for sharing your passion and explaining how SDI is a different model, and we appreciate that.
A replicable model. Mm-hmm. Yeah, thank you. You're welcome.